right? The lips may turn blue, all right? As the gasping you told me. So these are the things that you need to know, that this is the point I need to give her the medication. Make her calm, but at the first time, you should be also relaxed, all right? Do not panic. I know it's very difficult to say, but, and it's quite challenging, but you need to do not panic, relax yourself, make her calm, make her in an upright position as comfortable as possible, all right? Then bring the medication, put it, as I told you, this is to be placed on the mouth of your child, all right? Make a good seal, all right? The seal should be like, so see, in a sitting position, good seal, all right? Then what you have, make sure that there is nothing foreign body or something. It's also clear of an
2 minutes remaining.
You have to give one puff while she's make her sure that she take a good breath. Wait for a few seconds, then you can give another puff. All right. Then wait for a few seconds. Let's see how much she's improving. All right. You can give a maximum of like 10 puffs. All right. Even then she's not improving. This is the point that you need to inform to the ambulance. All right, and need to come back to us immediately.
Okay.
All right. Am I clear so far?
Yeah.
Do you have any question that I should make?
No.
All right. So make sure that once you are done with the medication, you should be aware that you need to clean this as well. All right. Do not, rub it vigorously. It will, hinder its delivery of the medication. You can just warm a lukewarm water, place it, and shake it, and let it air dry.
Okay.
Am I clear so far?
Yes.
All right. Do you have more questions to answer?
No, doctor.
All right. At any point, you feel that you're not clear, I'm here. You can call me. I can share you some links. You can see those videos as well. All right. That will give you an idea how to deliver the medication. I would like to have a review of her of Miss Batul again to see how well she is doing. All right. I'm going to give you an asthma diary. All right. What you can do is that try to find about the triggers as you're not aware. Maybe due to weather, maybe due to dog, maybe due to pollen, maybe due to carpeted home. What you're gonna do is that for how long she have to wake up at night, what symptoms she experience, just document it and bring back to us in a mutual way. We will find out like what's the trigger and how we need to prevent it, the future attacks.
Okay.
Do you have any further question that I should? Are you happy with the consultation?
Move on to the next station.
Okay. It was not too bad, I would say. I think after a long period of time, if you did it. Again, when you are talking, when you asking, make it more conversation, make it just involved
The mother.
as a team, okay? So it is important that you use such buzzwords that as a team, I'm thinking to make sure that we work along and Batul is better, she is not suffering from this. I know this can be very stressing for the child, so I'm worried about her. So what do you think if we sit together and talk about how to look after your child after she goes out of the hospital? Okay, I'm really worried that she has come so many times. It might be upsetting her. She might feel scared, and it may affect the child growth as well. So, like those kind of things. Why this conversation is important? Okay, just highlight those things. Why we are sitting together. So, would you mind if I ask you a few questions? Is anything that is causing the triggers? Okay, any change in the carpet, anyone smoker at home, any new pet? Okay, so when she mentioned that we have a dog, you would have asked whether this is new or do you think that the number of episodes of asthma have increased or they stay the same? Okay. And do you have or any parents have allergy, any allergy? Okay, so that can also give you an idea. And
Sorry. And is it good at the beginning we should ask? So what medication was given?
Yes, you can ask.
Do you know which one is for what? Then
Yeah,
we can start.
yeah. Okay, but she did ask about that. Yeah, she did ask. But the mom didn't know about it. She said, I don't know, I'm so confused. Okay, and that can happen, honestly. That can happen. Many of the time you see the patients do that. Okay. Just recently, about 2 weeks ago, I saw a black mom. She was treating her son with the thyroxine. Okay, it was 16 years old boy with big bulging eyes, very young now, when he was brought in. It was the first presentation, and mom had started thyroxine about 6 months ago. Okay, she tried to get hold of the GP. She could not get the appointment. Then she looked for the signs and symptoms. She got the thyroxine. Um, Sorry, not thyroxine, iodine um, supplements from Amazon, and she showed everything to me. Okay, the parents sometimes they struggle. She said it's a nightmare to get hold of the GP or to get the appointment. Okay, and the child he was found to have infective endocarditis, I think, and few other issues. His eyes were really bulging. Okay, he was so short of breath and struggling really. You don't know what is going on in people's life. Okay? Now you missed the first P absolutely. When he showed it, always ask, did you see this before? Has someone spoken to you about this? The first P. Previous knowledge, understanding. Okay? So now when you are showing this, this is an inhaler, of course I know. Okay? And this is an aero chamber. Okay? This whole unit is called aero chamber. As with the EpiPen is a single-use drug delivery device. This is a multiple-use drug delivery device. Okay.
I forgot the whole thing's name.
Aero chamber.
The whole thing.
Yes. Okay. Aero chamber.
Multiple use drug delivery system.
Yeah. Okay. Which means that you can use it many times as you want. Okay. You need as long as it is not broken. Okay. So then you explain the parts of this. When you're asking about this, do you know anything about it? Then you explain that these are the three parts. This is a inlet for the inhaler, and this is a mouthpiece. This is a spacer. Okay. Now
Which is the space?
this middle
Okay.
part. Okay. This middle part is a spacer. Now there are a few things you all need to focus on. This little pointer and this notch. This is a notch, okay, for the nose. Okay. So this pointer and notch both should be in the same direction, and the inhaler should be connected in this direction. Okay. The canister should be pointing, all should be in the same line. Okay. In the mouthpiece, it has this orange uh, valve. Okay. It moves with the breathing. Okay. So now, when you need to use it, make sure that the child is comfortable. Cuddle the child. Sometimes the children can be very anxious. They can be scared of the episodes. Okay, so don't worry. Just cuddle them, calm themselves, and get them in your lap. Okay, sit them upright and connect this. After checking this, now before you do that, make sure that you check the expiry. Okay. Expiry is always written. You do not have to remove the canister. It is written in the black area. Okay. So it is always visible. If you see, it is always visible. You do not need to remove the canister. In the EpiPen, it is written in the red. In the inhaler, it is written in the black area. Okay. So shake it well, connect it in the inlet, and making sure that they all in line. Then you take your child in your lap and put this on the face, making sure that this notch goes on the nose. and a tight seal has been made. How you will confirm that the tight seal is made? By looking on the movement of the valve. Okay? When the child will breathe in or out, you will see the movement of the valve.
Where is the valve?
This orange. Okay? This. Okay? This orange is the valve. Okay? So it moves with every breath. After you made the proper position, press it once and leave it there for 5 movements, for 5 breaths. Okay? After your child has taken 5 breaths, take it away and wait for 5 minutes. Okay? If the child does not improve, give 1 more puff. Okay? And wait for another 5 minutes. If the child does not improve, make sure you call the ambulance and continue using it every 5 minutes. Okay? Now, in this condition, if the child improves, they can keep the child at home, make an appointment with the GP, get the review. But with EpiPen, if the child improves, even then they have to come to the hospital. Okay?
So give 1 puff, 5 movements.
5 breaths, yeah?
5 movements,
Yeah.
and take it out. 5 minutes. And 5 minutes later, you have to repeat it.
Yeah, repeat it. If the child does not improve, repeat it. Okay? 5 minutes, wait. If the child does not improve, repeat it. Call the ambulance as well. Okay? And there are a few things that you need to be aware of. If you see any change in the color, if you see any crack, if you see any change in the color, it needs washing. If you see any crack, it needs changing. Okay? And it has to be changed every 12 months latest. Okay? So it is written on here as well. So you should not use more than 1 year. Okay? Change it every 12 months. If it does not break or nothing happens. Okay?
Replacing every 12 months.
Yes. Even if you use it once only, okay? So change it every 12 months. And also, your child will grow bigger and we may need to change the size of that. Okay?
Washing instructions.
Okay, so if you want to wash it, you don't need to do anything. Okay? Simply rinse, simply put in the tap water, okay, with the soap and wash it. Do not rinse, okay. Do not,
Wipe.
do not wipe it, yeah, and then leave it air dry. Okay. Any questions, guys?
So we have to wash the spacer one or the whole
Well, no. You need to wash the whole assembly. You can wash it.
separated or
No, you can just wash it like this, okay? Because it will be just a drug only. So always tell that leave it in the tap water and soap for a few minutes, so that if any drug is attached to the walls, it will become soft and washable. Okay.
So how do they know that the medication is getting over the amount of medication?
They don't need to worry about. They can check it. Okay. If they see the drug, and secondly, when you press it, you should expect some mist in this. Okay. Okay. If you do not see mist, maybe that the drug is finished.
Yes, sir. One question I want to ask.
Uh-huh.
Yeah, in the history, there have been in the scenario, it's been told that the patient has presented again and he was using the same medication. Shouldn't we be asking the mother how she was using the inhaler before and how which technique she was using?
So here the mom said that she did not use it. She didn't know about this.
Okay, okay.
Okay.
how many puff we can use maximum?
Well, there is no maximum limit until the ambulance arrives if the child is not well.
She's asking like how many pups will be there in one
No.
medication.
We will give one puff every 5 minutes.
Yeah.
And give another puff.
Yeah.
And then.
No, you can give up to 10 to 15, okay, until the ambulance
Until the
arrives, okay?
ambulance.
So if there is no way, you may use all of that.
Do we have to take it every time we use it or not?
No, you do not need to.